Ever felt that strange worry that something bad's going to happen, but you don't know why? Your heart beats faster, breathing gets hard, or worrying about things without a reason? In this video, we will talk about a topic that is probably on many people's minds, but they hesitate to discuss. Yes, we are talking about anxiety disorder, or in other words, restlessness or nervousness. Let's take a look at its main points that what we will explain in this video. First, we will see what it is, how many types are there, what are its symptoms, what causes it, how can it be prevented, how is it diagnosed, how can it be treated, and finally, its conclusion. So let's start with the first point and understand it in detail, one by one. So the first question that comes up is, what is anxiety disorder? Anxiety disorder is a type of mental health disorder where you feel nervousness or worry for a long period. This kind of worry affects your daily routine and makes it different from normal worries. Anxiety disorder is a mental state where you feel unnecessary and excessive worry or fear. This condition often damages your everyday life, such as in work, studies, or social interactions. I hope now you have a bit of an idea about anxiety disorder. Now let's understand anxiety disorder in detail, one by one. There are many types of anxiety disorders, but we will discuss some of the major types. Now, starting with generalized anxiety disorder. Here, you mostly feel worried and tense without any specific reason. Next, panic disorder. In this condition, you may experience sudden panic attacks, which include symptoms like rapid heartbeat, dizziness, and feeling of fear. Next, phobia, specifically irrational fear. In phobia, where you have an excessive and irrational fear of specific objects, situations, or activities. For example, fear of heights or fear of water. Next, social anxiety disorder, SAD. In this, you feel significant anxiety in social situations, fearing that you will be mocked or judged negatively by others. Next, obsessive compulsive disorder, OCD, and post-traumatic stress disorder, PTSD, are sometimes considered under the category of anxiety disorders. OCD involves repetitive thoughts or actions, obsessions or compulsions, while PTSD is characterized by intense fear or worry following a traumatic event. If you have noticed any other types, feel free to mention them in the comment box. Now, let's move to the next point. What symptoms it is? Now, let's understand what the symptoms of these disorders are. The symptoms of anxiety disorder can vary depending on the individual and the type of disorder, but there are common symptoms that can be observed in many people. These symptoms can be both mental and physical, affecting your daily life. It's not possible to cover all the symptoms, but I uploaded a dedicated video about a list of 45 anxiety symptoms. Click the I button to check out this video. In this video, we will tell you some common symptoms that will give you a much better understanding. Let's now look at these common symptoms one by one. Let's begin with excessive worrying. Imagine you are always engulfed in some tension, work from the office, the environment at home, or worries about the future. These thoughts constantly spin in your mind. Even the smallest matters make your mind overthink, and you can't find peace. It's not normal if this is preventing you from performing your daily activities, as it's a symptom of an anxiety disorder. Next, increased heart rate and shortness of breath. Imagine sitting calmly and suddenly your heart starts beating faster. You find it difficult to breathe, and you feel something bad is going to happen. This condition is called a panic attack and can occur without any real reason. It's a terrifying situation. Next, insomnia or broken sleep. Lying in bed at night, you can't find any trace of sleep. You keep thinking repeatedly, and even the slightest noise wakes you up. This problem with sleep affects your daily tasks, and you feel tired throughout the day. Next, pain and fatigue in the body. Without any physical exertion, you feel as if your whole body is in pain. Sometimes it's a headache, sometimes back pain. You feel as if you've done a lot of heavy work, although you haven't. These physical symptoms are also a manifestation of anxiety. Additionally, you might experience difficulties in making decisions, a constant fear of something going wrong, and a lack of concentration. If you have noticed any other common symptoms, feel free to mention them in the comment box. Now let's move to the next point. What causes it? Just as there are many symptoms of anxiety disorders, there are also many causes. Let's discuss some common causes one by one. Before we begin, it's important to understand that there can be numerous causes for anxiety disorders. and everyone's experience is unique. If you feel you are going through anxiety, talking to a doctor or a mental health specialist can be helpful. Never consider yourself alone or helpless. Seeking help is a sign of strength. Let's start with family history. If someone in your family has had issues with anxiety, then it's possible for you to have it too. It can be passed down through genes, meaning if your parents or grandparents had it, you might too. Next, adverse life situations. Sometimes life brings tough situations, like the loss of a loved one, job loss, or facing a significant hardship. These events can impact the mind and lead to anxiety. Next, mental health. Our brain operates on chemicals. Sometimes the balance of these chemicals, such as serotonin and dopamine, can be off. When this balance is disturbed, it can affect our mood and feelings, which can lead to anxiety. Next, stressful lifestyle. Today's busy life, work pressure, and continuous stress are also significant causes of anxiety. When we are under constant pressure, our brain gets tired, which can lead to anxiety. Next, health-related problems. Sometimes, certain health issues like heart problems, diabetes, or thyroid issues can also cause anxiety. These physical health problems can affect our mind and emotions. These were some of the common causes of anxiety disorders. Now, let's move to the next point. How can it be prevented? There are steps that can be taken to prevent anxiety disorders. Let's look at some common steps one by one. Let's start with reduce stress. Take some time out of your daily routine for rest and relaxation. Activities like yoga, meditation, or deep breathing exercises reduce stress and keep the mind calm. Next, get good sleep. A full and good sleep refreshes the mind. Sleep and wake up at a fixed time every day. Stay away from mobile or TV beforehand to ensure better sleep quality. Next, eat healthy. Eat a balanced diet that includes fresh fruits, vegetables, and whole grains. Reduce the intake of caffeine, tea, coffee, and alcohol as they can increase anxiety. Next, exercise. Regular exercise releases endorphins in the body, which are natural painkillers and improve mood. Spend some time walking or doing any physical activity daily. Next, don't hesitate to talk. Share your feelings with a friend, family member, or therapist. Sometimes just talking can make a big difference. You'll realize you are not alone and help is available. If you find it difficult to manage stress or anxiety levels, seeking professional help is also a good option. Mental health professionals can provide you with specific techniques and strategies that work for you. Remember, giving yourself time and taking care of your health is most important. These were some important points that can help prevent anxiety disorders. If you think there are any points missing, feel free to mention them in the comment box and share your strategies as well. Now let's move to the next point, where we will learn how the diagnosis or testing of an anxiety disorder is conducted. Before understanding the methods of diagnosing anxiety disorders, it's crucial to know that a correct diagnosis can lead you to the right treatment and support. The diagnosis of anxiety disorders is typically performed by a mental health specialist or psychiatrist through various steps and processes. Let's explore some common methods of diagnosis one by one. Let's begin with talk to a doctor. Firstly, you should see your family doctor or a general practitioner. Share your symptoms with them, such as how much stress you feel, how your sleep is, whether you experience panic attacks, etc. Next, physical exam. The doctor might first conduct a physical exam to check if there's any physical health issue that could be worsening your anxiety. Sometimes, certain health problems can exhibit similar symptoms. Next, mental health evaluation. In this step, you may need to meet with a psychiatrist, psychologist, or other mental health professional. They will have a detailed conversation with you to understand your thoughts, feelings, and behavior patterns. These were some important points that help in the diagnosis of anxiety disorders. Let us know in the comments how you found this video. Now we move to the next important point, where we will learn about the treatment methods for anxiety disorder. The treatment for anxiety disorder or anxiety can be conducted in various ways, depending on the individual's condition and how their body and mind respond. Let's discuss 4 common treatment methods one by one. Let's begin with psychotherapy. This is a type of therapy where, through conversations with a trained therapist, one can understand and resolve their issues. The most popular therapy is CBT, cognitive behavioral therapy, which helps you recognize and change negative thinking patterns. Next, lifestyle changes. Changes in daily routines can also reduce anxiety. Such changes include regular exercise, getting good sleep, eating healthy, and adopting stress-reducing activities like yoga and meditation. Next, support groups. Sometimes, sharing your feelings with others who are going through similar experiences can be very helpful. Support groups make you feel that you are not alone and that others are facing similar challenges. Next, self-help strategies. There are also some self-help techniques that you can try, such as deep breathing exercises, positive self-talk, and relaxation techniques. These can help manage anxiety in the short term. These were some important points on how anxiety disorder can be treated. If you think any points are missing, please let us know in the comment box and share your strategies as well. Anxiety disorder, or anxiety, is a common yet serious mental health condition that can affect your daily life. However, with the right information, timely diagnosis, and proper treatment, managing it is possible. Understanding and awareness, seeking help on time, the right treatment, a support system, a positive attitude, and patience. These points will significantly assist you in dealing with anxiety disorder. Utilizing them will make you feel better. This was our video for today, in which we saw first, how many types are there? What are its symptoms? What causes it? How can it be prevented? How is it diagnosed? And finally, how can it be treated? I hope you found this video helpful. If you liked our video, please share it with your friends, family, or colleagues so we can help them too. See you in the next video with the treatment of another condition. Until then, a big thank you, and please don't forget to like, comment, and share. Thank you.